In today's video, we're going to talk about a condition that affects many people and can feel a little embarrassing, but it's extremely important to understand: piles, also known as hemorrhoids. Throughout this video, I'll be using both words interchangeably because they mean the same thing. We'll cover what hemorrhoids actually are, their causes, symptoms and warning signs, what you can do at home to treat or prevent them, additional medical treatments, and the red flags you should never ignore. So let's get started. What are hemorrhoids? Piles are basically small lumps or swellings that develop inside or around your anus. They're very common, and in many cases, they improve without medical treatment. However, knowing how to manage and prevent them is very important. Causes of piles. Hemorrhoids are swollen blood vessels caused by increased pressure in the lower rectum. This pressure can develop from sitting too long on the toilet, being overweight, straining during bowel movements, pushing hard while trying to pass stool, heavy lifting, pregnancy. These factors increase stress on the veins around the anus, leading to piles. Signs and symptoms. Your symptoms will depend on what type of hemorrhoid you have. Here are the three main types. 1. Internal hemorrhoids. These are located inside the rectum and usually aren't visible. They're normally not painful but can cause painless bleeding during bowel movements, bright red blood on tissue or in the toilet. A prolapsed hemorrhoid, where the lump pushes out through the anus, causing irritation and discomfort. 2. External hemorrhoids. These develop under the skin around the anus. They may cause itching and irritation, pain or discomfort, swelling around the anus, bleeding. 3. Thrombosed hemorrhoids. These occur when blood collects inside an external hemorrhoid, forming a clot. They can cause severe pain, swelling, inflammation, a hard, sometimes dark-colored lump near the anus. Prevention and home remedies. Let's talk about what you can do to prevent piles, and how to manage them if you already have them. Here are 9 things you should do. Drink plenty of water. Increase your fiber intake. Use moist toilet wipes instead of dry tissue. Take paracetamol if you're in pain. Sit in a warm bath to reduce itching and discomfort. Apply an ice pack wrapped in a cloth. Gently push a protruding pile back inside if possible. Keep the anal area clean and dry. Exercise regularly and reduce caffeine/alcohol to avoid constipation. Now here are 6 things you should avoid. Don't wipe aggressively. Don't ignore the urge to pass stool. Avoid straining while pooping. Avoid painkillers containing codeine, they cause constipation. Avoid ibuprofen if your piles are bleeding. Don't spend unnecessary time sitting on the toilet. Home treatment options. If home remedies aren't enough, you can try over-the-counter medicines. Your pharmacist can recommend creams to reduce swelling, itching, or pain, e.g., Anusol. Laxatives to soften stool. Cold packs for relief. If these don't help or your symptoms are severe, it's time to see a doctor. When to see a doctor? You should visit your doctor if your symptoms are getting worse. There's no improvement after 7 days of home treatment. You frequently get piles. You notice changes around your anus. You're losing weight without trying. You see visible bleeding. You have a fever or feel unwell. There is pus leaking from the area. Your doctor may examine the area and might need to insert a gloved finger to check for internal piles. Hospital treatments. If home and pharmacy treatments don't work, hospital-based treatments may be needed. These include non-surgical options. Rubber band ligation, a band placed around the pile to cut off blood supply. Sclerotherapy, a liquid injected to shrink the hemorrhoid. Electrotherapy, a mild electric current to shrink the tissue. Infrared coagulation, heat used to cut off the blood supply. These procedures are usually quick, and you can go home the same day. If these fail, surgery may be needed. The surgeon will explain the available options. When to go to the emergency department. Seek emergency medical help if the bleeding doesn't stop. You pass large blood clots. You have intense, unbearable pain. So that's everything you need to know about piles: what they are, their causes, symptoms, home remedies, medical treatments, and when to seek urgent care. If you have any questions or want to share your experience, feel free to comment below. Check the description for more helpful information. Thanks for watching, and see you in the next video. Bye.